Hello. So all of you have a piece of paper in front of you, and I want you to look over this paper right now, and I want you to pretend that you are the head of a company and you are hiring for a new office administrator. So you are looking for an office administrator and you have received many applications, and one of them you have received is from John Joyce. So all of you have John Joyce's application. I want you to answer my question and everyone needs to answer it. Would you hire John Joyce? So raise your hand if you would hire John Joyce as your office administrator. Okay, now raise your hand if you would rather hire someone else. Interesting. Okay, so basically, I'm here to talk about the anti-fat bias. And the anti-fat bias is the preconceived assumptions you might have over someone's personality and their characteristics based off a visual assessment of them being overweight. So what this means is it's basically you judging someone negatively for them being overweight. Now, in the little demonstration I just did, I hope I show you how anti-fat bias is prevalent. Now, the front half of the room got John Joyce's survey, or it got John Joyce's resume, and then the back half of the room got the exact same resume, except it had a photo of John Joyce on it, and he was obese. Now, what I expected to find was that the people who received a resume with John Joyce's photos would be less likely to hire him than the people who received the resume without the photo. This would be an example of the anti-fat bias. There was an experiment done really similar to this. There's been many done, but one was done in 2011, and it is called the, I forget the name. And basically the results of this study were to show that people who are obese or overweight are hired significantly less than those who weigh an average weight. So what this means is that if you are overweight, you will be less likely to be hired for any job. And even if you're more qualified than the average weight person, you will still be less likely to be hired. This is really interesting because it goes further than this too. If you are applying for a job that has a lot of social interaction with other people, you will especially be hired less if you are obese or overweight. So a lot of you are probably wondering, why are you talking to SCNAs about the anti-fat bias? And it's because as CNAs, you will be working with obese or overweight people on a daily basis. You will be providing care for individuals who cannot care for themselves, performing tasks such as bathing, eating, clothing, toileting, and just kind of grooming, helping them with anything they need. The reason they can't do these things by themselves is often because of limited mobility or immobility. And in this case, along with other factors such as drug side effects, lack of exercise, and health problems, leaves your patient sometimes overweight or obese. Now, you need to care for these overweight or obese patients as you would any other patient. You need to provide adequate care for everyone. To understand the anti-fat bias and understand that you might have these preconceived negative ideas over people who are overweight and obese, it's important to learn about explicit and implicit prejudice. So explicit prejudice is when you are aware that you have prejudice against a certain group of people. So for example, if you were in the back of the room and you didn't want to hire John Joyce because he was obese, then that would be an example of explicit prejudice, because you are aware that you have this prejudice against him. But then implicit prejudice can come about sometimes you can't control it and you aren't even aware you have it. It can be in your subconscious. So for example, if I was to open the door for average weight people, but I never opened the door for an obese person, and I thought, oh no, I don't have any bias against fat people, but obviously I do, because my behavior is discriminatory, even if I'm not aware that I feel this way. So a big part of being able to prevent yourself acting discriminatory based off the anti-fat bias is being observant of your initial reaction or your snap judgment of things. So for example, you might walk into a room and you're going to see that your patient is overweight, or you'll receive a chart with their information and you'll notice that their weight is more than average, and you'll think, great, this patient's going to be hard to deal with, they're going to be more work. But no, if you observe your initial reaction, you're thinking, oh, I'm being discriminatory, then you can go on to change your behavior. So I'm going to show you all some slides. There's going to be 2 different sets of photos, and I want you to observe your initial reaction for each photo, for each set of photos. So here's the first set of photos. The first set of photos is of people, just average weight people doing average activities, and they're walking, they're exercising, things like this. Most reactions to these people are maybe that was attractive, or they're average, they're like me, nothing special. Okay, here's the second set of photos. Ding. So these photos are of overweight people and obese people, and normally a reaction received about these people is, ew, they're gross, they're fat, cover that up. For example, if an obese woman goes to the beach in a bikini, people will think it's disgusting and she has to cover herself up because she's gross to look at. So these are all just anti-fat bias. You are assuming that these people are a certain way just because of their weight. So, for example, so yeah, that's no good. Like, I was looking for images on Google online, and it's hard to find an image of an overweight person when they're not making fun of themselves, someone else isn't making fun of them, or they're not eating. Like, there's no just professional pictures of someone who's like larger on the internet. So to find a photo for John Joyce was even a struggle for me, just because like people are so demeaning towards people's weight on the internet that you can't just find a nice photo of someone. And so your job is to stop perpetuating this stereotype and to provide the same amount of care for obese people, obese or overweight people, as you would as any of your other patients. And trust me, they will be so happy to be finally be treated equal by someone, because mostly they are discriminated against in their everyday life. Overweight people, as well as like disabled people and homeless people, are part of this category that are just different from an average person, and they make people feel really uncomfortable because they're different. So to kind of comp for this difference, people treat them as an outsider and they just don't want to see them. So they just like don't want to see this obese person. They need to cover up. They need to be less obese. There was a study done in 2001 about the prevalence of the anti-fat bias among healthcare professionals, because most people think, oh, you're a healthcare professional, or you're a CNA, you're a doctor, you can't be biased against your patients. But that's simply not true. These doctors have biases, these healthcare workers have bias against their patients just like everyone else. And the study found that although the prevalence of the anti-fat bias is lower among health professionals, it still exists. So I think that as CNAs, you all need to be aware of your initial reactions you have towards overweight people, and you need to change your behavior in a way where you can't reflect that, and eventually you will not have those stereotypes, hopefully, anymore. But it's especially important for you all not to be biased and to provide the same amount of care for everyone. So